Welcome. So this is going to be a short discussion of just how to write P4, P5, M4 and D2 of the Health and Social Care Unit Level 3 materials for meeting individual care and support needs. So I'm going to talk a little bit about the content and then how it can be applied. So just to look at the marking criteria, just for what we're doing in marking and writing section C, because it is a relatively large section. So in P4, you can see that we're looking at strategies and communication techniques to overcome a challenge. M4 looks at how those strategies, those communication techniques will support the needs of our case study characters and our individuals. So again, we're looking at how they're supported. And evaluation is always assessing how useful they are going to be, how they are helpful, how they're not helpful, the strengths and weaknesses of these techniques. P5 continues this by looking at the concept of personalization, particularly personalization of care. And as always, for the merit is how that impacts on your character, your individual, and then the distinction is the evaluation of it. So it is almost a case of the pass is always going to be the content and the materials and the information. The merit is going to be about the application of those materials to your characters, and particularly as the question says here, assessing how useful they are going to be, how are they going to help or change the situation of your character, and evaluation justify the uses of them. So are there more strengths or are there more weaknesses from their use? What I'm going to do during the session, I'm going to talk about overcoming challenges, which is part of P4, communication and communication theories, which is also part of P4. One of the things about this section is it does relate, and I think it does overlap quite heavily with P2, particularly the core elements of communication, which you would have talked about in part P2. So you can bring forward and repeat some of those ideas. And then lastly, you've got personalization care, which is for P5. So let's just quickly talk about overcoming challenges. Now, overcoming challenges means identifying the challenges, the barriers, the things that can cause your characters to be unable to access support and care in obviously their situation. There are 6 different types of challenge that your case study characters and anyone can face in society. So you've got awareness challenges, which is about individuals maybe being unaware or not knowing of support availability for them, how to access treatment, how to obviously get access to alternative forms of treatment. So it's a lack of awareness. Practical challenges, as the name suggests, is about again, those barriers. So it could be mobility issues, it could be transport issues, it could be obviously physical application of medication and treatment issues. Skills is about people lacking the skills they need, so whether that's for employment, whether it's to do with obviously caring for another individual. Access and belief could be the barrier that religion might provide in terms of accessing treatment, providing treatment, or it could also shape the the understanding of individuals towards their health. Motivational challenges refers to someone's lack of motivation, whether they have high or low levels of motivation. And then communication is just obviously being able to articulate and express people's feelings, whether that's verbal, written, or any other means. So these are the communication issues as well, which will repeat a little bit as we move on. So when it comes to these 6 kind of challenges, what we need to think about is how they might apply. Now this screen just has a load of potential, again, these are very, very obscure and very, very random contexts and case studies and issues. But what I wanted to highlight with this is that an individual can have several challenges facing them in any given context. So you might have, for example, like we've got Billy, who's worried about the side effects of his medication. He's unaware where to get advice regarding possible alternative treatments. That is really an awareness and knowledge issue because he doesn't know how to get access to other support. We've got Ethel, it's elderly clients who's worried about affording a care home. So that's a practical financial challenge. And then she's not aware of funding. So that's kind of overlapping with awareness. You might look at Betty on the far right side. So lives alone and cannot leave the house. That's a practical challenge. She wants to communicate with her friends and family, which is linked to communication, but does not have access to a computer or doesn't know how to access a computer. So that's obviously an element of skills challenge, but also we could say an element of practical challenges. So having the computer, but also knowing how to get hold of one. and she feels she would like to learn to do this. So that could be a motivational element, a positive motivational challenge. So again, all these case studies just show that different situations can be several types of challenge, and that's what's going to cross over into our case studies. So if you think about the 6 case studies we have in our coursework and the types of challenge that they may face. So we started with, obviously we can go through Nusrat, and we'll look at awareness challenges, and then we'll go through the others. So when it comes to awareness, it's about understanding the support that's available to them. So again, for most cases, we can tick this. For Nusrat, it's about, she wants to live independently, have relationships. She is having issues with her medication. So that could be linked to Nusrat. But Patrick is about where he can find support, particularly from discrimination from his landlord, but also about his diagnosis and obviously treatments for his HIV. Alice, again, awareness and knowledge. We can maybe think about bereavement counselling, her going to AA, getting additional support for her condition. Brenda obviously wants more support from the asthma nurse, doesn't like lots of people involved in her care plan, doesn't know what to do. So again, it might be informing her of alternative ways she could support herself. Martin, obviously, he has lost his job, he has his skin condition. So again, you could look at getting advice, particularly in terms of improving his CV, his job opportunities. And Maria, lots of issues there because, again, she's having problems with her work life, looking after her mum, the availability of care. So again, there are awareness challenges in Maria's case. Practical challenges, again, do they have any barriers to overcome? So with Nusrat, the main challenge is her living independently. So she may not have the skills to do that. So I'm going to kind of tick 2 off there. So practical challenges that she may not be able to look after herself, live independently, and that could be linked to a lack of skills. For Patrick, not really any practical challenges for Patrick, other than maybe we could think about his martial arts and attending the martial arts lesson, maybe his concerns over sustaining injury or bleeding, and obviously the very, very minimal risk that could pose in terms of transmission of HIV. Alice, practical challenges would be her attending the aerobics class while under the influence of alcohol and her drinking. That could be considered a practical challenge. Brenda, again, I suppose it's the asthma. It doesn't have a massive impact on practical challenges, so probably not so much a practical one for Brenda, because it's not influencing her ability to do something. Martin, I guess the practical challenge is he can't do his woodwork because of his skin condition. And Maria, there are practical challenges in terms of caring for her mum and managing her work life. Skills that are needed. Obviously, Patrick, not really any skills there for Patrick that he needs to learn. For Alice, skills, again, not really a skill or something she needs to learn to do. Same with Brenda. Martin, you could maybe think about employment skills, employability skills. And Maria, you could think about care skills for Maria so she can look after her mum. Religious beliefs. Now, again, as far as we are aware, and what's been expressed from the item and the case studies, is that none of our case study characters really have a religious belief, or as far as we can tell, do not have a religious belief. So again, we wouldn't need to really consider religion, but maybe, again, it's that we could look at the idea of accepting their needs or acceptance of needs, or whether people accept whether a need or they have a need, they need support. So maybe with Alice, obviously needing support. Maria, obviously with her mum, maybe not accepting that she needs help to look after her mum. Maybe Nusrat, that needs to accept that if she takes her medication more consistently, that would help with her care. But as I say, a little bit of a stretch there. Motivation, so levels of motivation to make a change. So Nusrat wants to have a relationship, wants a job, wants to live independently. They are all motivations for her. Patrick, obviously motivations, he wants to maintain his martial arts class. So that could be a motivation for Patrick to seek support and get treatment. Alice, maybe we could look at the lack of motivation to stop her drinking. Brenda, Nothing really motivational in Brenda's case, obviously about managing her health condition, but you could come up with some ideas if you wanted to think about, her improving her health, or maybe find alternatives that could motivate her to kind of try and improve her situation. Martin, motivation could be to get a job, to get his skin condition under control, get back to woodwork. And Maria, the motivation is quite strong in her case. She wants to look after her mum. And communication challenges. Now, again, in our context, and obviously Nusrat has communication issues. Alice does, using an advocate. Brenda uses an advocate. Martin has reading difficulties, so we could put that as a communication, but I'm going to kind of get rid of that because it's not an overt or massive communication, but I'll kind of put it in different colours. It's a mini one. And Maria, definitely communication challenges with her mum because of the language barrier. So with this, thinking about your case study characters, the ones you've selected, you can write a little summary of, these are the awareness issues. This is what they mean. This is how it would apply to Nusrat. This is how it applies to Patrick. And just link it and just kind of put a little explanation of how it would apply to your characters. Now, the next bit is identifying the challenges. So we've already done that. We have said, this is the challenge we think these case study characters would hold. And actually, in this context, you need to think about yourself as a healthcare professional. So we know the issues because we've read the case study. We've read about the characters. If you are a healthcare professional, you're meeting these people for the first time, you'd have to think about how you would find this information out. And this is a little bit of a link to methods. So the research methods you would use to gather the research. So the methods you can talk about is observation, focus groups, talking informally, which is interviews, and questionnaires, which you can use. Now, don't get too bogged down in the research methods, because there's a bit there, but summarize what the method is. And I think the best thing to then do is think about which would work best with your case study characters. So thinking just off the top of my head, questionnaires, a written list of questions. We know that's not going to work with Martin. We could maybe think about talking informally to patients. Would that work best, particularly with those of an advocate? Focus groups, probably not going to work too well with those who are using advocates, because if there's a group discussion taking place, the advocate would then have to relay that information to your case study character, and that can make communication difficult. Observation, what are the challenges there? Think with Alice, you might be observing her behaviour, whether she's been drinking. Could she be hiding what she's feeling, her symptoms? And then the strategies to overcome the challenge. Now, these 6 challenges were identified at the beginning. Talking about the strategies, the main thing about them is how you would overcome a problem, how you'd overcome a challenge. And all these strategies kind of provide a framework, an idea of overcoming a challenge. Now, all this information is in the textbook, so I'd say take a look at it, but I'll just summarize them in a second. So the main strategies we've got is education, information, and promotional materials. Training courses, opinion leaders, clinical audits, computer-aided systems, policy frameworks, all in your textbook. Now, what I would say is talk about each of these individually. So what are each of these different types of strategy to overcome the challenge? Try and include examples. So, for example, education materials, think about like health or promotions. Think about like the Change for Life and the healthy eating campaign. So think about promotions and campaigns to overcome barriers, challenges, and problems, and try and think about how they would help people overcome them. Is it providing a skill? Is it providing information? Is it to try and motivate people? So opinion leaders, for example, is really good for highlighting about motivation and awareness. When you think about the celebrity figures that help support charities and organisations, they're there to motivate, to inform, and raise the profile of these organisations working to support people. So again, talk about the strategies and then think about which ones would work best with your 2 chosen characters. So just to start your write-up, kind of a little framework here. So start off by what the challenges are, define them and outline them. Talk about your case study characters, link them to the challenges. What are their challenges? Why do they have this challenge? Move on to how you would find out what their challenges are. So as a professional, healthcare professional, how do you identify the challenges your characters face? What methods could you use? What research methods work best with your characters and why? Move on to the strategies. What are the strategies? That's a lot. This is all the P4, kind of outlining the key information. And then moving on to the merit, what would be the best strategy to use with your case study characters? How is it going to help them overcome barriers and challenges? And then the evaluation might be thinking about how beneficial is it going to be? How available are these services? What is the cost? Is it going to make a significant difference? Is it going to be high impact? Think health promotions and campaigns. Will they provide the information your characters need? Is it going to provide all that support? So again, that's the first part of the section P4 materials. Now the next bit is moving on to communication. So there are loads of communication theories to look at within this topic. I'm just going to flag up the key thinkers, and I'll come back to this in a second. So Charles Berner is a communication thinker, and he talked about how communication had 12 steps, and the idea being that someone will communicate, they will choose who to communicate to, and again, it's about how you be specific, you would present information, the recipient receives it, and he's talking about a communication cycle, and this is about how information is passed from one person to the next. Now I'm going to come back to this in a second, because I think this argument by Michael Argyle is a development of Bernier's work, and actually I think it's easier because it has a diagram. And he says it's this process. So the first person will have an idea and they come up with something. They code a message, they create a message, and then they are sending the message out via communication to the second person. They hear the message, they see what's being said, and they perceive it. So for them, they come up with the idea. They decode the message and break it down, and then they would provide feedback with those kind of communication techniques of agreement or nods to show that they understand. And then the process would repeat. So then again, the idea is formed, code it, send it, receive, and it's a back and forth between these two characters. Now this is obviously a really good communication technique, and again it builds on the work of Bernier, as I say. So it's the same process, just presented differently. But what I was thinking about is a really good way of thinking about these communications is the barriers. So the things that could make it difficult to do. So for some of our case study characters, they have an advocate. I'm just going to put a little person here. So we have the same idea of ideas, messages being coded. It then has to be passed on to the advocate, who will then do the same thing and then pass the message on. So it adds a third person to this process, and that could make it slightly more difficult because you've got these different communications going back and forth between individuals, particularly if there's an advocate or a translator. For some people, you know, we think about Nusrat, obviously the idea about message being perceived, that could be problematic with Nusrat or with Maria's mum. So there are some issues with communication, some barriers, some challenges, and again, why this theory may not work perfectly. Another discussion or another theory is Tuckman, and he talked about the stages of group communication. So again, this is more about communication between a group. Most of our case study characters are kind of individuals, but you could mention this theory, particularly thinking about maybe the healthcare providers, the professionals working with them, and the stages are forming, storming, norming, performing, and adjoining, and basically coming together, talking about the issues, agreeing on what should be done, setting a clear focus for sort of the goals and meeting on the next step, and then completing the task. So again, this might be for the professionals rather than the individuals. So as you move into the rest of P4, main steps to do, this will come out of sync, is, you know, what are the communication theories, issues? I've put P2 here because a lot of what you did in P2 I think can still be used here. You can still apply it. It's your work. You've talked about this stuff already, so you can reuse it. But this bit here will be adding in the theories, link it to your cases, and then try and think about the pros and cons of using them. And then last but not least, we've got personalization. So personalization is a term about designing care around the needs of the individual. It's shaping personal goals and providing specific support. And the key thing is about looking at what the service user wants, helping them purchase and pay for services, on providing benefits and support, and looking at how they want the service to be delivered. There are different types of care plan to bring in. So again, the main thing to think about here is, what are the needs of your characters? What support do they need, if they need any support at all? Would it be a care plan, which is about providing some form of care with daily tasks? Is it a learning plan to help them learn new information? Or is it a behavioural, about trying to change a behaviour or an action they're engaging in? So some plans might apply better to some cases. So for example, learning might apply to Nusrat. Care could apply to Maria. Behavioural to Alice. So again, it's thinking about who would link to each plan. And then just to sort of build on it, think about the local authority, the role of the council. How would care be provided? So think about, things like living support allowance and attendance allowance. These are kind of support benefits to help people with different needs, but there are restrictions on who can apply for them. And also with this, think about the importance of giving more choice. How does providing choice and opportunity to design care, choose care, how does that help your individuals? The big thing here is about promoting independence, empowerment, and how that can be good and bad for the characters. So just to sort of move on to the second part of the write-up, outline what personalization is and how it's funded. Think about your cases. What type of personalization might they choose? What type of care do they want? How would they provide it? Who would provide it? And how would they pay for it? And why would they want it? What's the benefit of giving them choice, which is moving into the merit here. So what's the benefit of personalization? How's it going to help them? And what would be the problems if you didn't give them choice? And then lots of the evaluation is the usage of it. How easy is it to get this support in place? How likely are they going to get the things they want? We know from the case studies, Brenda was too concerned about lots of people knowing her business and being part of her sort of triangular care and her medical plan. So her wanting to have less people involved, maybe if she took that on a personalization approach, is that something that would be done? Is that possible to reduce the scale of her care team? And then what you do for section C, last but not least, is put it all together. So start off with your challenges. You can link it to communication, and again, the communication challenges, and then the personalization towards the end. The whole way through, remember, think about what's the content, that's the pass, application to your cases, and how useful it is for them is the merit, and evaluating the theories, that's going to be your distinction. Okay, thanks for watching.